Well, thank you so much. I'm delighted to be here today and part of this workshop. I have to say in advance, looking at the terrific panels that we have and looking at the program, I'm sorry that I have teaching duties and childcare duties that are going to keep me from attending much of this session, but delighted to be here and look forward to learning from my colleagues, from the panelists, the practitioners, what more we can do. What I've been asked to do today is to give an overview of bullying by providing some basic information, for example, about what is bullying, how is it defined, what does it look like, so what are the types and modes of bullying that children experience or are engaged in, how common is bullying, and how might those prevalence rates vary by gender, by age, for example. What are the various roles that children and youth may play who are directly involved in bullying? And finally, what do we know about the effects that bullying can have on children who are targeted, children who observe bullying going on around them, the climate of the school, and of course, ultimately society in general? So let's start with the definition. As Mike indicated, we need to be sure we're on the same page with our terminology. As attention to bullying has grown in recent years, concerns have been raised that our efforts to define and describe bullying haven't been entirely consistent, and that this lack of a consistent definition may hinder our ability to really understand the scope, the magnitude of the problem, to measure the impact that bullying may have on children and youth, and certainly to track trends over time. In fact, these very concerns were raised in 2010 at the very first Federal Partners in Bullying Prevention Summit that took place here in Washington, D.C. Participants at the summit questioned, when we talk about bullying, when we study it, when we look to design and implement interventions, prevention efforts, what exactly are we talking about? What is bullying? So in response, the Centers for Disease Control and Prevention and the U.S. Department of Education launched an initiative to develop a uniform definition of bullying. An expert panel of about a dozen researchers and practitioners were identified and were convened to provide some advice and feedback on the document. And as you can see here, this is the agreed upon definition which was published just earlier this year, that bullying is any unwanted aggressive behavior by another youth or group of youths that involves observed or perceived power imbalance and was repeated multiple times or is highly likely to be repeated. And further note that bullying may inflict harm or distress on targeted youth, as we've heard. Now, perhaps it'd be useful to unpack some of the elements of this definition for a few minutes. I think the first key element to highlight is that bullying, of course, involves unwanted aggressive behavior. Unwanted meaning that the targeted youth wants the aggression to stop. Bullying doesn't, of course, include playful taunting or teasing that both enjoy. Now, of course, a challenge for both youth and adults who work with kids is we can't, of course, always easily tell if behaviors are unwanted or not. The document also defines what we mean by aggression, since that's a critical part of bullying behavior, noting that aggression is intentional use of harmful behaviors that are threatened or actual. And notably, the focus in defining aggression is on whether the aggressor intended to use harmful behaviors, not on whether that aggressor intended the target to experience the injury. A second key element in the uniform definition is that bullying involves, as we've heard from the panelists already, an imbalance of power. The aggressor is using observed or perceived personal or situational characteristics to exert some control over their target. Now, of course, power differences can be characterized by many factors, such as physical characteristics, differences in size or age or strength, but they can also often include other factors such as popularity, Background demographic characteristics, perhaps, such as whether or not a child's a member of a majority or minority racial or ethnic group, may be characterized by differences in social, academic, physical, or other skills or abilities, or even access to resources, money, or information, such as being able to reach an entire student body with the click of a send button. And finally, of course, there is power in numbers. There are many different ways that a power differential can be characterized. A third key element of bullying is its repetitive quality. There's a recognition that bullying is typically repeated over time. Bullied children often experience multiple incidents or a pattern of aggressive behavior against them. So the question is raised, what if there's a one-time occurrence? Well, according to the CDC, a single incident can be considered bullying if there's a strong likelihood that it will be followed by more like it. So, in other words, just because bullying is typically repeated over time doesn't mean that a one-time occurrence can't be bullying or that adults should wait for a pattern to emerge before responding. The uniform definition also acknowledged that bullying often, of course, inflicts, as we've heard, harm or distress on the targeted youth. But I think it's perhaps important to note that this isn't a requirement for a behavior to qualify as bullying. Not all bullied youth may be able to immediately identify or express what harm or distress they may have experienced from bullying. For example, a child with developmental delays or disabilities may not always recognize that she's being harmed by being taunted or teased, but it's bullying nonetheless. And of course, as we'll talk about later, there are a wide variety of negative experiences or injuries that can result from bullying, which the uniform definition recognized. So what does bullying look like? The uniform definition document recognized there are two distinct modes of bullying: direct bullying, which occurs in the presence of a targeted youth, and indirect bullying, such as rumor spreading or encouraging others to exclude a peer, which are not directly communicated but reach the target indirectly. The uniform definition document also recognized that within these different modes of bullying, there are a number of distinct types of bullying: physical bullying, verbal forms of bullying, and relational bullying, which is designed to harm the reputation and the relationships of a peer. Now, it may be useful to talk for just a moment about the relationship between aggression, violence, and bullying, as sometimes these terms are used interchangeably and often inappropriately. As I've mentioned, bullying, I think, is clearly a form of aggressive behavior. All bullying is aggression, but not all aggression is bullying. For example, a fight or a nasty argument between two peers of equal power or strength certainly is aggressive behavior, but probably wouldn't be characterized as bullying. What about violence? Violence is also a form or a subtype of aggressive behavior. The World Health Organization has defined violence as intentional use of physical force or physical power. And as you can see here, violence can overlap with bullying when it is physical in nature. There also may be some confusion about what constitutes bullying versus harassment. Harassment is a legal term. Some bullying may constitute discriminatory harassment under federal law. In 2010, the U.S. Department of Education's Office for Civil Rights issued a Dear Colleague letter on harassment and bullying in order to do a couple of things. The first was to clarify the relationship between bullying and discriminatory harassment. And a second purpose was to remind schools what their obligations were under anti-discrimination statutes. This Dear Colleague letter, which has been very influential, highlights that bullying of an individual based on race, color, national origin, sex, or disability can be a civil rights violation if it's sufficiently serious that it creates a hostile environment. Well, with this background information about what bullying is, let's turn to take a look at what we know about its prevalence. Some statistics were mentioned earlier. Let's dig a little bit deeper into those. In their review of more than 80 studies that have examined bullying prevalence among children and youth, Clayton Cook and colleagues found that the prevalence rates vary according to a number of variables, not surprisingly, such as the time frame of interest. Are we asking kids how much bullying they've experienced in the past year, in the past 6 months, the past week? Rates will vary accordingly, of course. They also vary with respect to the measurement approach. Is bullying defined for kids? If so, how is it defined? It depends on the particular informant. Are these self-reports? Are they reports about peers' experiences? Or are they teacher reports? The answers will vary. And of course, they also have varied depending on the geographic location of the study. So with this recognition that there is wide variability in rates of bullying across studies, let's take a look at some prevalence rates here in the United States. And I'm going to focus on several national surveys that provide some insight into the prevalence. And I'll describe 4 briefly and would like you to note that each focus on slightly different age groups of interest. The first, as was alluded to earlier, is the school crime supplement to the National Crime Victimization Survey, which I'll refer to as the NCVS, which found that 28% of 12 to 18-year-olds said that they had been bullied at school in 2001. The Youth Risk Behavior Survey, the YRBS, which is a national survey of slightly older kids, high schoolers, reported that in 2001, 20% of students had been bullied on school property during the previous year. A third national survey, the Health Risk Behavior Survey, the HBSC, which collects data from a nationally representative sample of children and youth in grades 5 through 10, reported that during the 2009-2010 school year, 27% of youth had been bullied at school at least once in the previous couple of months. Note that time frame is different from the others. And 11%, I apologize, there's a typo, 11% of youth had been bullied 2 to 3 times a month or more during this time frame. And then finally, the National Survey of Children's Exposure to Violence, which involved a national telephone survey of caregivers and of youth. The age focus was from 2 to 17, found that 13% of children had been physically bullied and 20% had been teased or emotionally bullied during the previous year. Now, researchers who are interested in examining the prevalence, the nature, and the effects of bullying have often analyzed the experiences of 3 distinct groups of children who are directly involved in bullying. The first group are youth who bully others, but who themselves aren't bullied. The literature often refers to these kids as aggressors or perpetrators or sometimes bullies. A second group are youth who are bullied, but who don't bully others, sometimes referred to in the literature as targets or victims. And then a third group are youth who are both, who are bullied themselves, but also bully other kids, often referred to in the literature as bully victims. In a review of studies that examined bullying prevalence, Cook and their colleagues found that the greatest proportion of students who were directly involved in bullying were children who were bullied, followed by kids who bullied others, and then the smallest group are kids who were often referred to as the bully victims. And you see here a graphic. These are data, a pie chart from a large-scale study of 3rd through 12th graders that my colleagues and I collected in the United States to illustrate this picture. We found, for example, that 13% of our sample of children and youth said that they had been bullied regularly. So regularly, the blue pie slice, 2 to 3 times a month or more often, that 4% had bullied others with that frequency, the orange pie slice, and the smallest pie slice were those kids who had bullied others but also been bullied. So what are the most common types of bullying that children and youth indicate that they experience? I'm going to take a peek at data from 2 national surveys. Here we see data from the Health Behavior of School-Aged Children study. And as you can see, the most common forms of bullying that kids said they had experienced were verbal bullying and having lies spread about them. You can see that both of these are a good bit more common than physical bullying, or even at the far right-hand side, different forms of cyberbullying. And a peek from another survey, the National Crime Victimization Survey, also finding that verbal bullying and rumor spreading that were the most common forms of bullying that these 6th through 12th graders said that they had experienced. We see again a smaller percentage having experienced physical bullying, social exclusion, being threatened, being forced to do things that they didn't want to do, having property destroyed. And then interestingly in this survey, 9% of students said that they had been cyberbullied anywhere in the last year. What do we know about boys and girls' experiences of being bullied and bullying others? Well, a recent meta-analysis found that boys and girls experience relatively similar rates of being bullied. As, for example, is shown in the figure on the right, these are data from the National Crime Victimization Survey. Slightly more girls than boys said that they had been bullied, and studies differ in prevalence rates, but typically relatively similar rates of kids overall, boys and girls say they are bullied. However, in the meta-analysis, boys were almost twice as likely as girls to bully others, and were about 2.5 times as likely to be the bully victims, to both bully others and be bullied. Not surprisingly, there are similarities and differences in the frequency with which boys and girls experience different forms of bullying. So, for example, in the 2011 National Crime Victimization Survey, they found that girls were more likely than boys to indicate they had been bullied through name-calling, through rumor spreading, through social exclusion, and also through cyberbullying. Boys, on the other hand, in this survey were more likely than girls to say that they had been physically bullied. Children's experience with bullying also vary according to their age. Research suggests that the likelihood of being bullied is greatest in elementary and middle school grades and decreases throughout the high school grades. So, for example, in the National Survey of Children's Exposure to Violence, where researchers looked at the experiences of kids aged 2 to 17, as you can see plotted here on the right, they found that children and youth were most likely to be bullied, whether physically bullied or emotionally bullied, in middle childhood, ages 6 through 9, followed by the 10 through 13-year-olds, then followed by the 2 to 5-year-olds, and finally followed by the 14 to 17-year-olds. Similarly, on the left, you see from my own work, our large-scale survey of more than 20,000 students in grades 3 through 12, we observed that rates of being bullied were highest in our survey among 3rd graders, about age 9, and decreased steadily through elementary, middle, and high school grades, both for boys and also for girls. Excuse me. And then on the right, you see, again, decreases in rates of being bullied with age, according to the National Crime Victimization Survey from grades 6 through 12, where about 37% of 6th graders said they had been bullied at school in 2011, and 22% by 12th grade. Although these data suggest that bullying victimization overall is particularly likely in middle childhood, children are more or less likely to be involved in specific forms of bullying at different ages, depending on their verbal, their cognitive, and social development and circumstances. So, for example, here you see fairly steady decreases in being verbally bullied from 6th through 12th grade. That's the blue line that you can see there. And also physical bullying, the yellow goldish line. However, as I've highlighted with the arrow, reports of being bullied through electronic means, perhaps not surprisingly, appear to peak later, about 10th grade. So compared to these age trends for being bullied, somewhat different age patterns are observed for kids' self-reports of bullying others, and also their reports of being bully victims. So here you see findings from a large-scale study conducted by my colleagues and I that I mentioned earlier, where we found that age trends for self-reports of bullying others varied according to gender. So among the boys, bullying others increased from about grades 3 through 12, not dramatically but fairly steadily. But among girls, rates of bullying others seemed to peak in 8th grade. In their meta-analysis, Clayton Cook and colleagues saw somewhat different trends. They observed that rates of bullying others decreased from ages 3 to 18, while the likelihood of being bullied and also bullying others, the bully victims, peaked in the adolescent years before then decreasing. Although attention to bullying has, as I alluded to earlier, increased markedly among researchers and policymakers and members of the press since the early 2000s, it's still unclear to the extent to which rates of bullying have changed in recent years. So on this slide and on the next, I've plotted out rates of being bullied for 3 of the major national surveys for which we have data over time. And these are data here for the HBSC study, which looked at 11, 13, 15-year-olds. And what we see are somewhat different trends over time depending on the gender of the participants and the frequency of involvement. So the percentage of students who said they were bullied occasionally, which are the lines on the top part of the graph, and this was defined as once or more in the past couple of months, decreased between 2001 and 2009 for boys and for girls, heading in the right direction. The lines on the bottom are frequent victimization, so kids who said they had been bullied 2 to 3 times a month or more often, and we see decreases for boys between 2001 and 2009, or mostly 2001 to 2005, but we don't see these decreases over time for girls. What about trends for the NCVS or the YRBS? Well, looking at the data on the top 2 lines, the National Crime Victimization Survey, overall, data from the NCVS show reductions in the percentage of these 12 to 18-year-olds who said they were bullied at school by about 12% between 2007 and 2011. But while the decreases were steady for boys, you can see that they did not exist for girls. And finally, the lines on the bottom, data from the YRBS, which again looks at high school students' experiences in the previous year, showed no changes between 2009 and 2011, the only 2 years for which there are comparable data given changes in the wording of questions over time. So what trends do we see over time? The answer, as my daughter would say, is it's complicated. The current answer, I think, depends, of course, on the database that we're looking at, whether we're looking at frequent or occasional bullying, whether we're looking at boys or girls, and the particular years of interest. I think the next data point or 2 on these charts are really going to help us determine whether and the extent to which we are moving the needle, as Dr. Liu is reminding us is our goal, whether we're moving the needle on rates of bullying. So what is known about the consequences of bullying? In my time left here this morning, I'm going to very briefly review mostly longitudinal data that can help us understand the possible effects of being bullied on bullied children, long-term outcomes for children who bully. Why should we be concerned about these kids? Possible effects on bystanders. What are the possible effects of bullying on the broader school climate? And also speculate about the costs to society of bullying. A very large body of research has confirmed a relationship between kids' involvement in bullying and internalizing problems among kids. So children, in other words, who've been bullied and those who are identified as bully victims are more likely than their peers to be involved, who aren't involved in bullying, to be depressed, for example, anxious, and exhibit suicidal thoughts and behaviors. Although there's been a lot of research looking at the association between bullying and these internalizing behaviors, less research has examined the short and long-term consequences of being bullied. A number of longitudinal studies, however, have confirmed that being bullied is associated with the development of later internalizing problems, including depression, anxiety, and low self-esteem. Other researchers have found that bullied children over time are more likely than their peers to develop psychosomatic problems such as headaches, stomach aches, sleep problems. Some longitudinal research has found that being bullied was associated with some later externalizing behaviors up to 2 years later, such as aggression or delinquency or misconduct, although a number of researchers have found conflicting results here. And finally, being excluded or picked on by peers has also been linked with later school avoidance and lowered academic achievement. So what is known about the relationship between being bullied and suicidal thoughts and behaviors? There's much interest and concern about possible linkages here. And although researchers have concluded that there is a relationship between bullying and suicide-related behaviors, relatively few longitudinal studies have been conducted to explore causal links between bullying and later suicidal thoughts or attempts or deaths. In a study that looked at short-term impact of being bullied on 7th and 8th graders, bully victims and girls who were victims of bullying were at risk for suicidal thoughts 10 months later, even after controlling for these factors at baseline. And a few studies have examined long-term effects of bullying on suicidality. For example, research by Clemson and her colleagues shown that being bullied in childhood predicted later suicide attempts and deaths by suicide in one study for girls but not for boys. And Copeland and colleagues found that boys who were bully victims in their childhood, 9 to 16 years of age, were at greater risks of suicidal thoughts or behaviors as young adults. And although research indicates a connection between being bullied and suicide-related behaviors, it's important not to overstate or misinterpret the connection. The causes of suicide are very complex, and there are numerous individual, relational, community, and societal factors that can contribute to the risk of suicide. I want to mention a recent study using data from the National Violent Death Reporting System here. Researchers looked at what precipitating circumstances were present for youth who had died by suicide, ages 10 through 17. And they did find that school-related problems, which included bullying, but there were many other school-related problems, were determined to be a precipitating circumstances in about a quarter of the deaths by suicide. A small percentage of these, 12%, appeared to be related to bullying. To put that number in context, intimate partner relationship problems were identified as a precipitating circumstance in about a half of the deaths. What do we know about long-term concerns about children who bully? Longitudinal research following children who bully also indicate there is good reason for concern. For example, a meta-analysis of 18 different studies found that bullying others were related to a greater likelihood of being involved in later criminal behavior and antisocial behavior. As another example, Dorothy Espelage and colleagues recently found that bullying others was associated with later sexual harassment of others among middle school students. Of course, bullying frequently occurs in the presence of bystanders or witnesses. By one estimate, more than 80% of bullying is witnessed by others. Research suggests that bullying can have significant effects on bystanders, although much more research is needed here. Bystanders have reported feelings of anxiety and insecurity, which often have prevented them by self-report of seeking help. In a recent study, compared to peers, those who had observed bullying reported more symptoms of helplessness, interpersonal sensitivity, feelings of being hurt or inferior, and even potential suicidal thoughts. Many have argued that bullying, if it's prevalent or if it's not adequately addressed within a school environment, can contribute to a negative school climate. Cohen and his colleagues, in fact, note that safety issues, which include attitudes and experiences related to bullying, is one of 4 essential dimensions of school climate. And research confirms connections between bullying and aspects of school climate. So, for example, students who perceive that there are supportive staff at their school, perhaps not surprisingly, are more likely to seek help for bullying. And Dan Olveus found that bullying prevention efforts were associated not just with decreases in bullying at schools, but also improvements in the social climate of classes. Kids reports of being satisfied with the school, more positive attitudes towards school, more positive relationships with peers. And finally, not only may bullying negatively affect individuals who are targeted, the bystanders who observe bullying, or the school community as a whole, but bullying problems also entail substantial costs to society. Individuals who've been formally involved in bullying, either as ones who were targeted, ones who bully others, or both, have been found to be over-consumers of society's health and social services. Although we don't know precisely what these costs are, some researchers who've attempted to quantify related costs indicate that the cost of saving a high-risk youth from a career of crime is between $2.6 and $5.3 million per youth. Future research will no doubt help to quantify these societal costs of bullying, but I think there's certainly ample current evidence that the individual human price tag is far too costly. Thank you very much.
Thank you very much. We will have time for questions after the next group. We are running ahead of schedule a little bit, so Patty and I had not built a break into the time schedule, but I think we'll go ahead and have a break now, give people a time to get refreshments outside. The restrooms are out past the double doors there. So why don't we come back here at 10:15. I'm sorry, 10 o'clock. 10 o'clock.